Okay friends, so welcome back in another video tutorial for microbiology with Shagnik. So we have already discussed about the all the topics that is mentioned in antibacterial agent in our syllabus. So today we will now I would like to add to another topic. One is why we are mixing or why you are using combinational drug therapies, and second one is the generation of antibiotic. Okay, because remember, when we have talked about cephalosporin in cell wall synthesis inhibitor, I have told you the terms first generation, second generation, third generation. So I would also talk about this. I will also talk about this in the upcoming video. Okay, so let's get started. So first one, what do you mean by MDTC, that is multi drug therapy? Okay, it is MDT, not MDTC. So MDT, multi drug therapy or combinatorial drug therapy, or what do you mean by antibacterial synergism, or why combination of the antimicrobial agent are used to treat a disease? So that is the today's topic. So before going to talk about this, what do you think? Why we are using antibiotic in mixture? So we are sometime using mixture. So let's say in your class there is a fight and you have made a partnership with the boy which is the strongest boy in the class. Okay, so why you are making a partnership? Okay, because as he is the strongest boy in the class, so you will get a advantage that you do not have to perform too much fight, right? He will fight for you, right? So similar in the case of antibiotic, that why we are using mixture of antibiotic to get some benefit, right? When we are using antibiotic for treating infection. So what are those benefits? So first of all, we are using mixture of antibiotic for treating life-threatening infection. Okay, so to prevent emergence of bacterial resistance. You know what, the second point is the main reason, that if we use a mixture of antibiotic, so there will be a reduced chance that the bacteria can develop resistance, right? The third one is to treat mixed infection of aerobic and anaerobic bacteria. Okay. The fourth one is to enhance antibacterial activity. Synergism. So what is synergism? We will going to talk about this in this video. Okay. And to use lower doses of a toxic drug. So that is the 5 important reason why we are using mixture of antibiotic, right? The first one is to treat a life-threatening infection, to prevent emergence of bacterial resistance. The third one is to use low toxic dosage of drug, right? And another one is to enhance antibacterial activity, that is our synergism. And the last one is to treat mixed infection of aerobic and anaerobic bacteria. Okay, so let's move. What are those kind of mixtures? So another important addition, that sometimes we are also use antibiotics in mixture when we don't know about the precise agent of the serious infection. Okay, that means which microorganism is particularly responsible for that infection. Okay, so under such circumstances we can use mixture of antibiotic just by looking on the symptoms. Okay, and we are also use mixture of drug to prevent the emergence of resistance, right? And it is mostly observed in case of tuberculosis treatment, because you know what, we are using 4 drugs together to treat tuberculosis. If I find it important to make a video on tuberculosis, then we will discuss about tuberculosis in details. So there are 4 drugs. One is isoniazid, rifampin. Okay, pyrazinamide, and the last one is ethambutol. Okay, so ethambutol. So these 4 drugs we are using in combination to treat Mycobacterium tuberculosis infection. Okay, mind it very carefully. First thing. Another important thing that sometimes we are also using to prevent the emergence of bacterial resistance in case of the chronic infection therapy. Okay, so it is clear that we are using mixture of antibiotics to get some benefit, right? That can be they will prevent the emergence of bacterial infection, bacterial resistance. Okay, sometimes it can be they will increase their antibacterial activity, that is our synergism. Sometimes it can be when we will use a mixture of antibiotic, we have to use a low toxic dose of drugs, right? And sometimes it can be to treat mixed infection, that is aerobic and anaerobic bacterial infection. Okay, so now we will going to discuss about 3 things that can occur when we are using drugs in mixture. Okay, so let me write it here. The first thing that can occur is synergism, second is indifference, and the third one is antagonism. So we will going to discuss about synergism and antagonism and indifference in very simple examples, then we will going to discuss the definition. Okay, so suppose again there is a fight in your class, so you are A and so okay, let's make it more interesting. So first of all, suppose A and B are in love. Okay, so but they are in so called a good relationship. Okay, A motivates B for her growth and for her good career, along with B also motivate him to, that means B also motivates A to achieve what he wants in his life. Okay, and she also motivates him for his growth. Okay, so this is a so-called good relationship, we can say. That means the activity of A and B increases together, right? But A cannot get such type of activity when he was used to be alone. Okay, similarly B also cannot get such type of performance when she was used to be alone. Okay, so what we can see, the mixture of A and B increases their activity in combination. Okay, so this is what synergism wants to tell us. Okay, that means synergism occur when a combination of two drug causes inhibition or killing when used at a 4-fold lower concentration. That means suppose we are using A as an antibiotic, B as an antibiotic in individuals or in separately. Okay, so under such circumstances we have to use the concentration of A on the concentration of B that we have to use is 4-fold higher than when we are using A and B in combination. Okay, that means it is clear that the antibacterial activity of the mixture of the antibiotic is higher than when we are using them separately. Okay, so that is the concept of synergism. Okay, that means simple thing, when you are using 2 antibiotics in mixture, they increases their activity. Okay, so now let's discuss the example of synergism first. So first example is penicillin streptomycin. Okay, so penicillin is the cell wall synthesis inhibitor we have discussed earlier, and if you have not watched the cell wall synthesis inhibitor video, then I would like to recommend you to go and watch it. Streptomycin is a aminoglycoside antibiotic and which is a 30S inhibitor. right? That is our ribosome. Okay, that means it is protein synthesis inhibitor. And another thing that I want to clear, that streptomycin is an example of aminoglycoside. Okay, and remember one thing, aminoglycoside binds with 30th subunit of the ribosome irreversibly, okay, and changes its structure, right, and facilitates a bactericidal activity. Okay, that means streptomycin ensures death. Don't be confused, because we are often considering all the protein synthesis inhibitor as bacteriostatic, but it is not that. Okay, aminoglycosides are bactericidal, and also penicillin. Now you try to think that when you are using penicillin and streptomycin in combination, penicillin will ensure the death of the cell wall and streptomycin will ensure the death of the organism by inhibiting the protein synthesis. Okay, so as a result, the activity will be more higher than when we will use penicillin or streptomycin separately. Okay, so the combination of penicillin and streptomycin we are using for Enterococcus facilis endocarditis treatment, and carbapenicillin and gentamicin combination we are using for treating Pseudomonas aeruginosa infection. Okay, clear? And I have not discussed here about their mode of action, because carbapenicillin is a cell wall synthesis inhibitor and gentamicin is also another aminoglycoside inhibitor. Okay, so now this example we have already talked about in the folic acid pathway. Okay, that's alpha methoxazole and trimethoprim, which are collectively called Bactrim, have the ability to inhibit two part of the folic acid cycle. Okay, so they have the synergistic effect, right? And along with that, in any two penicillin who have the ability to inhibit two different stage of cell wall synthesis can be considered as synergistic. Okay, and it is mostly observed in case of gram negative bacteria. Okay, so that is the concept of synergism. That means when you are using two antibiotics in mixture, the activity or the antibacterial activity of them increases. Okay, so now let's talk about antagonism. So what is antagonism? Let's again go back to our normalized example. Suppose let's say P is a boy and Q is a girl. Okay, and they are in relationship, but it is a kind of teenage toxic relationship. Okay, that means P always wants to talk with Q and Q also wants to talk with P 24/7, and as a result their career hampered drastically. Okay, so under such circumstances what we can conclude, that the combination of P and Q reduces the activity of either P or both P and Q. Okay, so that is the case of antagonism. Okay, that means when we are using two antibiotic in mixture, either the activity of one or both component reduces. Okay, clear? I think you cannot be confused with the help of such type of easier examples, right? So the first antagonism example is bacteriostatic agent and bactericidal agent when we are using combination. Now I want to make one thing clear, that here it is an example of synergism, right? But in place of streptomycin, if we use another kind of protein synthesis inhibitor which show bacteriostatic activity, then it will be an example of antagonism. Okay. Okay, so for example, we have used, let's say tetracycline. Okay, so it can be a antagonism example. We will going to see it. So the first example, as I have told you, that chlorotetracycline and penicillin together is a antagonism example, that is pneumococcal meningitis treatment. So now the question is, as they are showing antagonism, so why we are using it? Okay, because this is not a good thing, and I have told you that we have to use biology in the industrial purpose. So what is the use of using chlorotetracycline and penicillin in mixture, as they are reducing their activity, right? So let me told you that yes, tetracycline and penicillin in mixture causes antagonism, but they are useful for treating mixed infection caused by gram positive and gram negative bacteria. For example, pelvic inflammatory disease due to Neisseria, gonorrhea and chlamydia. Okay, so because I have told you that we are not only mixing antibiotics just for getting resistance, just for preventing the bacterial resistance, or just for getting a good antibacterial activity. No, we are also using antibiotics in mixture, okay, so that we can prevent mixed infection caused by gram positive, gram negative bacteria. For example, pelvic inflammatory disease caused by Neisseria, gonorrhea and chlamydia. Okay, clear? Similarly, some beta-lactam antibiotic who induce beta-lactamase can cause a antagonistic effect when we are also using another beta-lactam. Okay, let's say a beta-lactam antibiotic A who induces beta-lactamase and we are also adding B. So that is obvious, the beta-lactamase that is induced by the beta-lactam A will causes inhibition of beta-lactam B. Okay, so is this a synergistic effect? No. Is this a example of antagonism? Obvious. Okay, so here we have discussed that chlorotetracycline and penicillin we are using for pneumococcal meningitis infection is a sign of antagonism, but we are here using to treat mixed infection of aerobic and anaerobic bacteria. Okay, for example, pelvic inflammatory disease due to Neisseria, gonorrhea and chlamydia. Okay, and then the last one is indifference or antagonism. This is like the two classmates who never talked with each other someday do some work in combination. Okay, that means A and B used to be classmates and they have got a job in the same office and they are not supporting each other. Okay, so if we use A and B in separate, the result we get is exactly equal to the mixture when we are using. Okay, that means if we use A antibiotic and B antibiotic in separate, the result that we will going to obtain will be exactly same when we will use A and B in combination. Okay, so that is the three things that can occur when we are using antibiotics in mixture. First of all, synergism, that means two antibiotics will increases their activity in mixture. Second one is antagonism, they will reduces their activity in mixture, and it is mostly observed when we are using bacteriostatic antibiotic and bactericidal antibiotic together. And the last one is indifference. Okay, and indifference mostly occur when two antibiotics or two or more antibiotics that when we are using in mixture, they do not causes anything. Okay, that means the activity that we have get when we have used them as individuals is exactly equal to the activity that we have now when we have used them in combinations. Okay, so now we will also do a important question from that topic so that your concept will be more clear. So as you can see, there is a question that explain how aminoglycoside antibiotic and cephalosporin in combination act synergistically. So we have already discussed that aminoglycoside antibiotic is 30S inhibitor and cephalosporins are cell wall synthesis inhibitor. They are under the class of beta lactam, right? So they will act synergistically, right? Because they are not interfering with their activities, it is quite clear, right? And they are increasing their activity together. Okay, so here I am completing our discussion. So I hope you have understand sorry. So I hope you have understood the concept very well. So thank you for listening to this class, and if you like my videos, please like and share and subscribe to my channel. Thank you.